Auscultating heart sounds is a critical skill for nurses to assess cardiac function. The heart produces two main sounds, S1 and S2. S1 is the lub sound, caused by the closure of the mitral and tricuspid valves at the beginning of systole. It's best heard at the apex of the heart. S2 is the dub sound, caused by the closure of the aortic and pulmonic valves at the end of systole. It's best heard at the base of the heart. When auscultating, you use a stethoscope to listen in key areas. Aortic area, right second intercostal space. Pulmonic area, left second intercostal space. Tricuspid area, left lower sternal border. Mitral area, at the apex in the fifth intercostal space. In addition to the normal S1 and S2, listen for abnormal sounds such as murmurs, due to turbulent blood flow, often caused by valve defects. S3 and S4, abnormal sounds often linked with heart failure or hypertension. Nursing care involves recognizing abnormal heart sounds and following up with further assessments or diagnostic tests like echocardiograms. Early detection of abnormal heart sounds can help in managing conditions such as valvular disease or heart failure. Auscultating heart sounds is an essential tool in your nursing assessment to ensure your patient's heart health is properly monitored. Stay sharp.